it's CJ. Welcome to week 12 of your pregnancy. Today I want to talk about what's happening with your tiny human, some of the more common symptoms that you might be having, what you can do to alleviate those symptoms, and when you should be concerned. And if you stick around, I will also give you a list of things that I recommend you do while you're busy making a human. At this point, your little one is now measuring about 2.1 inches. That's 5.4 centimeters from the top of their head to the bottom of their booty. That is the crown rump length. And he or she now weighs about 2.1 ounces or 58 grams. Your baby this week is about the same size as a lime. He or she is now able to open and close their little hands and curl their toes. The beginnings of the toenails and fingernails are beginning to form. The kidneys are making urine, the pancreas is creating insulin, and the thyroid is beginning to function. If you have an OB visit this week, you will hear a heart rate, probably with a Doppler, that's running anywhere from 140 to 170 beats per minute. Here's the good news. The placenta has now taken over your pregnancy, so your hormone levels are on their way back down, and you should be starting to feel better very soon. Some of the more common symptoms. Number 1, nausea with or without vomiting. I encourage you to eat small, frequent meals throughout the day. Avoid foods that are greasy and or spicy. And if all else fails, talk to your OB provider about medication that can help with your symptoms. Number 2, fatigue. You are still so tired. After all, it is hard work making a human. Try to get as much rest as you possibly can. And oddly enough, getting outside and getting a little bit of exercise can also help with that fatigue. Number 3, occasional headaches. That is due to the extra estrogen that is being produced by your placenta. I encourage you to drink lots of water and work on some relaxation techniques that can decrease your stress level. Number 4, dizziness or lightheadedness. Again, try to stay very well hydrated. Make sure you're eating small, frequent meals throughout the day. And if you are feeling dizzy or lightheaded, try to lay down on your side. If you can't lay down, sit down and put your head down between your knees. Number 5, shortness of breath. It is very common. As long as you are able to breathe, you are fine. If you have a history of asthma, however, that is something that your provider definitely needs to know about, and it needs to be well managed. And number 6, understand you are going to have some cramps, some twinges. That's very normal at this point as your uterus is growing. Your uterus, by the way, at this point is the same size as a grapefruit. So what symptoms should you be concerned about? Bright red bleeding that's enough to saturate a pad. Cramping or severe pain of any kind that won't go away. And finally, if you are struggling with depression and or anxiety, please make sure that you talk to your provider about that. And if need be, get into some form of therapy. So what are the things that I recommend you do now that you're in your 12th week? Number 1, document your baby bump. If this is your first baby, you may not have a bump, and that's okay. You still have really good muscle tone. If this is not your first baby, or if you are carrying more than one child, you definitely have a bump, and you want to make sure you get a picture of that. Number 2, start a pregnancy journal. You've got a lot of changes going on right now, and sometimes it helps just to write those things down. Number 3, talk to your partner and start thinking about your finances and creating a baby budget. Between diapers, childcare, clothes, baby stuff, kids are not cheap. Number 4, if you have your OB visit this week, make sure you check on those genetic testing results. And number 5, make sure you're writing down all of the questions that you and your partner have in preparation for your upcoming OB visit. In the meantime, if there are any questions that I can answer for you, please feel free to leave those in the comment section below. And while you're in that comment section, I sure would appreciate it if you'd hit the like button, or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.